Thank you very much for the invitation, Michaela, and thank you very much for coming today and listening to our story. I hope you have had a good day today. Has it been good so far? Great. So I'd like to tell you a bit about Accelerating Australia and what it means for biomedical innovation and what we're seeking in the new generation of entrepreneurs and innovators that come through. So we are a national consortium and we focus on boosting the biomedical innovation and entrepreneurship for Australia, and we do that through three means, and that's training. We have lots of linkages, so we do a lot of collaboration support, and then we also provide commercialization advisory. So like if you're running a biomedical enterprise, this is how you would look at this problem. I'd also like to thank MTP Connect, which is the Industry Growth Centre that's funding us 50%, and CERI, which is the Centre for Entrepreneurial Research and Innovation, funded by Charlie Bass. And CERI is our lead consortium organisation. So biomedical science, what do we mean with that? It's really that biological basis of human structure and function, and how you apply this to fix diseases, to encourage well-being, and to help the society. Quite a lot of innovations have happened in the past. So in the 1200, you already had spectacles. Just imagine you can't have your glasses today. So it's really, really important that we focus on these innovations. And we've got vaccines. We've got a lot of things that we take for granted today. Look at, we sometimes we're upset with the pharmaceutical industry because of side effects of drugs, but just the ability to synthesize drugs is actually pretty amazing. So before we didn't have that, and I can promise you there's lots coming in the next 20 years. So from an industry perspective, we're looking at what are the real big problems that we need to solve. And one huge problem is the cost of healthcare. So by 2020, globally, we're going to spend $8.7 trillion. That's huge. And half of that amount comes from only 3 diseases. And that's cancer, cardiovascular, and respiratory. So that's massive. So they're definitely key areas that we focus on. There are also 642 million diabetic patients if we look to 2040. That's what we expect to have by then. That's big. We have, for those, unfortunately I have to stand here, 46.8 million people with dementia. And now guess what? Every 20 years that number doubles. That's big. And then there are, nearly 37 million HIV patients worldwide, 70% of which live in Africa. So, we have some really big things to solve, and we need to be on the ball. So a bit about biomedical tech business, so the life sciences industry. So what's actually happening there? So you've got the pharmaceuticals, biotechnology, which is vaccines and gene therapies, generics, it's a big part as well. And then you've got medtech, which is medical devices, that also includes digital. And then the distributors are a big chunk. It is the industry of the future because we're all going to live longer, hopefully. And it is a really nice, impactful way of going to work when you can change lives. One of our main issues in this space, of course, we got to balance. It's very complicated to get this through. You've got to balance the safety versus efficacy. So it's a bit like walking that line, but if you fall down, you might be killing people. So it's not an easy ethical spot to invent in. And this is a bit of it's a bit complicated, but this is how it looks like when you do a drug development. you know, if you look at the percentages, it's the success rate to get into the next phase. Now, overall, only 1.8% of drugs actually reach the market. That's an enormous risk. What's even worse, it's costing $2.6 billion to develop one drug. So you can't do this alone. It's a team exercise. And it's a bit like we often say, it's like driving this truck around with the doors wide open and your money is flying out. So Fiona Woods, she's on our executive committee, so that's the board of Accelerating Australia, and she always says, like, you have to bring your A game. You don't show up to work unless you bring your A game, and that is so important in the medical sphere. So for her as a clinician, everything she does, she will innovate, she will engage with the latest technologies. It's not enough to just think, you know, to stick in a dogma of medicine. You, as a clinician, you need to invent as well. Yeah, so we're up for a big transformation. It used to be that we would, there would be 7 drugs in the world, or 8 drugs, that would cover most of the revenue in this space. Now imagine that's how pharma has been built. So they have blockbuster drugs. Well, that's not working anymore because we're going for personalized medicine. Not every person fits that one pharmaceutical. It needs to be targeted at the genetic composition of the person themselves and their circumstances. So that changes that whole business model. There's also a convergence of sectors. So it used to be that medtech was very separate from pharma. We're now looking at medical devices that have a drug component and a biological component, like a collagen patch, for instance. Also the digital becomes much more integrated. And we have some seriously disruptive technology coming to us. One is the digital health, and 2 is the gene technology. So if we can, with CRISPR for instance, could fix the genetic makeup, like where the faulty gene is, the whole disease will disappear in adults. Well, that's amazing, but that means there's a whole shift in thinking. So some of the other things, like we can 3D print organs. Just imagine that, that's great. Exoskeletons. We have here, down at the bottom, there's a stent, and if you put it in a vessel, a blood vessel, you can make it, so here it's implanted, and slowly but surely the body starts to build around that stent, and when the stent disappears, gets absorbed, the body has a new vessel. Pretty cool. And this is gene editing, of course. So we're really in the time for biomedical entrepreneurship. Everybody can come up with an idea of something to fix and then bring those teams together. And then it's a matter of also understand how to dot the I's so that you actually stay within the safety and efficacy. A bit about eHealth, just to make that clear where we're going. So we're really starting to combine the genomics with the digital capabilities. And what we want to target for is to get to disease prevention. That's kind of the ultimate goal. So that we get to a healthcare that's preventative instead of fixing a problem that's developed over time. So a few biomedical innovators. Can anybody recognize who would be on this picture? The Helicobacter. Yes, exactly right. This is Barry Marshall and Warren Buffett. They had the 2015 Nobel Prize for Medicine. They're WA based. That's amazing. And that was with the Helicobacter pylori. So before this time, we thought that stomach ulcers come from, you know, acid and, you know, stress, etc. We didn't realize it's a bacterial infection. That's pretty cool. And this is another team that I would like to highlight. So we got Sue Fletcher here and Steve Wilson. They discovered eteplirsen. And if you look at this picture here, So the upper one shows a bit like kind of simplified how a gene would look like. And with Duchenne muscular dystrophy, so this boy here has Duchenne muscular dystrophy. And before, these children end up in a wheelchair by the age of 5. And it goes downhill very quickly from there. So Sue and Steve, they invented a kind of like a Band-Aid, so that when the gene is replicated and turned into a translated into a protein, it skips the faulty part. And suddenly the body still has the normal protein again. These kids can walk now. Now that's, you know, imagine working in that space when you can create this kind of change. It's cool, really good. So with the high school students coming through, we have traditionally, we think of a biomedical career in a very siloed manner. So there might be scientific training and research, and then you go into a PhD or you do a postdoc, and you go into that chain to have an academic career. Some might go into industry, that's a very narrow line there, and then by retraining you could go into other biomedical spaces, like you could become a doctor. This is the reality. This is the actual career path of biomedical scientists. See this? 1 in 222 PhD student becomes a professor. That's the alternative career path. That's not the real career path. The career path is actually going into industry and creating change. Build new innovations and use your skills to have an impact. So this is quite shocking to a lot of people when you're not used to that scenario. So in Europe or in the US, that's normal. Everybody expects you go into industry afterwards. But here there are a lot of, like, the career options are quite narrow, and that's why we're trying to change that, and we're trying to get to give the courses and to give people the ability to set up their own company. And also, like, kind of like, biomedical is so diverse. You know, to enter it, you can do the traditional biomedical, you can do pharmacology, bioengineering, medicine, veterinary, allied health, nursing, but it can come from the data analytics, lawyers, business. It is really like, it's not that there's one set path. So when there are people, like students that you have that have a real passion for health, but may not have the STEM kind of package or the ATA package, it doesn't mean they can't actually have impact in this space. There are lots of different skills that we require, and the essential attributes are actually really counterintuitive. So on one hand, we want you to be innovative. The other hand, you need to have attention for detail. You need to be an analytical and a big picture thinker, passionate and objective. So that's a real tricky balance. We also want people who have emotional intelligence, are agile, critical thinking, judgment and decision making, people management, multidisciplinary team capabilities, and diligence. So they're actually the typical future skills that you'll see in any of these industries. So Australia, in 2016, the federal government had a good look at the industry, and they said, hey, wait a minute, we're first in the world for creativity. Isn't that impressive? We're fourth in the world for medical research. So we have the top kind of medical research with the small budget that we have. But we spent $8 billion in research and 0.3 in translation. So what's happening to our creativity? We're not using it. We're just going, all right, we've done it. Now somebody else touches it, and that's where it stays. So we're having all this amazing research and we're not doing anything with it. So if you look at the innovation output, Australia's at the bottom. So that had to change, and that is why the federal government came with the innovation agenda and why NTP Connect was created and subsequently Accelerating Australia. That's the other thing, so we definitely are looking for STEAM. We want the arts involved. That brings the design thinking that we require. It brings the passion for impact, the creativity. It really does bring an extra level to our STEM teams if we have the arts involved. So about Accelerating Australia, our task is culture change. So that's what we're trying to achieve. We do that by breaking through silos. So some of our activities, we take clinicians together with engineers, together with scientists, together with business people, and sometimes someone from WAPA, and give them the task to create a new medical invention. And it's quite amazing what they achieve and what they learn in this process about the complementary skill sets that they're having. And that's something that sometimes, like I find in my own children, they go like, oh, well, you know, Jonathan is so much better than me at maths, so I won't go there. And then Jonathan goes, oh, she's so much better in English, and the other boy is going, oh, they're so skilled in X, Y, Z, I can't do all this. I said, well, no, but you can work together, because, you know, when you're later in life, you need someone who has those skills. You know, your brother is there or your sister, but it's about understanding where your gaps are and how you fill them. And if we can teach the kids that, that's really phenomenal. So these are members. So we got UWA working with Monash and with University of Melbourne. These things weren't happening before, they were fighting each other. We also have additional, so Fiona Stanley is a part of it, Cook Medical. It's really quite amazing that we see all these groups working together just to help the ecosystem. So with our training programs, we have key ingredients. So we're looking for entrepreneurial mindsets, design thinking, impact-oriented, multidisciplinary, enterprise skills to empower. So they need to have some solid business skills, but also it's about deep tech for health. It's not like we have so many innovation programs about you know, a new app, which is great, and it has impact as well, but we're forgetting the real big science that we could work with. The courses in WA are the CERI courses, so that's entrepreneurial mindset, and Perth by Design, which is run through our own groups. So Perth by Design is pretty special. So this is the course for 6 months. These teams design. They actually go into the clinic. Each one has their own clinical mentor, and there they go and watch, and they look for problems in the clinic, and they take it back and they learn how to think about the problem in a, you know, by really understanding the problem, like the design thinking stage. And then we teach them how to prototype and invent and protect it and build the entire business case around it. When they come out, you have a 19-year-old pitching to investors with a real tech. This is a team like Amy, she's a clin psych from Telefon Kids. Rob is a business guy. Alex, he's at Curtin and he works for the Square Kilometre Array team. He's an engineer. And we got Martha as a GP. And they won the pitch night, and they invented this technology that allows you to manage irritable inflammatory bowel disease. So that's pretty great, but what I really want to talk to you about specifically, is CERI, because I think this is really applicable to the high school. So CERI has an entrepreneurial mindset boot camp. That's a 2-day boot camp, and we run this for academics at the moment to teach them entrepreneurial skills. It's actually a way of getting a bit of headspace and understanding where your core purpose is and how easy it actually is to get an action plan to action that. We use a lot of the lean canvas methodology, so just to think business models, and it's really, it opens a lot of pathways, and the people who go through this course start a lot of new businesses, and they're very, very successful. It's based on the Icehouse program, which is actually designed for high schools. Now CERI has flown around the world, so here you've got the teams. You've got Carolyn Williams, Peter Klinken, our chief scientist, Charlie Bass, he's the philanthropist, funding it all, and Barry Marshall. So Barry and Peter were there to open it, and my chair, Accelerating Australia, is Kevin Fleger. So there we got one of the teams that recently published one of their results, a blood test for melanoma for the really early stages, and it went all over the world. It's amazing. They didn't have any funding, so there's no funding for this. So they came to CERI and they sat in the boot camp, and then initially they said, why am I here? I'm a scientist. What am I doing here? And then after the 2 days, they said, oh my God, I didn't know what is possible. And within that time, so within a year's time, they're flying and they're doing really, really well. So the Icehouse student entrepreneurial program is really, really interesting. So they, up to date, they have 200 teachers certified, 7.5 students went through it, 37 campuses, 269 groups. There's down there is a link that I'm sure you guys can have the presentation afterwards. That link brings you to the report that describes all these results. But what's great is 97% of the teachers wanted this program back. They wanted to keep it. 91% of the students now had a vision, and they now knew why they were studying, what they wanted to achieve, so they were engaged. 82% of the parents agreed their children was much more focused at school. So it has a lot of impact. It kind of gives you a reason why you go to school every day. And you know, it would be great to run this at the high schools. So CERI would love to work with people. So CERI is qualified to facilitate, and they're happy. So if anybody wants to contact us, please do so. We would like to know whether there's appetite at the moment. And you can run this program instead of 2 days, you can run it over 6 weeks, just bits and pieces. Yeah. And a bit about Perkins. Not sure, like this might be more information for you to take home on the slides. So that Perkins runs a lot of programs for different year groups, and also it has these different academies. Also Telethon Kids is setting up a lab, so we get more and more of the research institutions opening their houses for high schools. So please interact with it. And if you've got any questions, just ask us. And that's it for me. Thank you very much for listening. Here's Kristen Houston.
Hey, oh, that's a weird sensation. Hear myself back at myself. I actually work with Maud at Accelerating Australia, but I just wanted to get up and talk for just a minute because I feel like I am sort of the typical student, either my pathway into university and out of it. When I was in high school, I had no idea what I wanted to do. For a time, I wanted to be a doctor because I kind of thought that was the only way I could have some kind of impact on people's lives and people's health. And I think my school's career advisor kind of was like, oh, let's be a bit realistic about this, because I liked to party and not study very much. But I did end up going to uni, and I did pharmacology at UWA. And I was kind of naive. I was kind of coming out of that degree going, someone will just like hand me a job, surely, like I have a degree now, they have to put me in a lab somewhere. And I was a bit shocked that that didn't happen. And then thankfully I got a really good business mentor, introduced me to Maud, and I ended up doing the Entrepreneurial Mindset Bootcamp, and that just sort of really opened my eyes that there are so many different ways that you can have an impact on people's health. and an impact on people's lives. So I really think if you have any students a bit like that, then you should definitely get in contact with us about doing an entrepreneurial mindset course at your school, or even if you want to do it, that's an idea too. But yeah, I just wanted to pop that in there at the end.
Okay.
Yeah.